All right. Well, good afternoon, everyone. I am super excited to have us all gathering today. My name is Robert Hess III. I am the CEO of the Health Insights Hub by Hess III Consulting. And we are here today to discuss Maricopa County and Pima County's novel approach to saving lives through heat relief. Today's presentation is sponsored by the Arizona Public Health Association, which we're super excited and grateful to them for their sponsorship. Will, I see that you're on, and I know we didn't practice anything, but do you want to pop on and say a real quick hello?
Yeah, thanks, Robert, for you and your team putting this on together. And are you recording
Yep.
this? And can we see it later, or you'll talk about that in a second, probably. And then I'll send it out to all of our AZPHA members in our Sunday morning newsletter. But thanks for all the lifting behind the scenes with Maricopa and Pima County to get this important information out. Thanks.
Absolutely. Thank you, Will. Really appreciate it. So I'm going to run through a couple of quick announcements, and then we're going to dive into the meat of everything that we are here to discuss. So just a gentle reminder, content today is intellectual property. We are happy to share it, but please reach out to us and ask, and we will gladly do that. And as Will mentioned, this will be publicly available on our website and then sent out via the Public Health Association. So thank you for that. I won't spend a lot of information or time talking about who we are, but as an organization, we've been working in Arizona for about 20 years, helping with health and human services, as well as work nationally. There are three elements to our organization. The first one, I'm going to start at the bottom of this list, is our traditional advisory services, which most people would expect from a consulting company. But we also have what we call our Health Insights Hub, where we offer some market intelligence dashboard that I'll show you in just a second, and some other things. And then we also have a nonprofit arm, which is called the Health Impact Community. And we hope that you will join us in some of the fun stuff that we do via these different organizations. So our advisory consulting services are very standard and straightforward. We help organizations, so payers, health systems, hospitals, provider organizations, counties, cities, state governments, with lots of different things in expanding access to care for health and human services very broadly. As I mentioned, our Health Insights Hub does a couple of different things, but two that we want to talk about today. I'm going to start on the right-hand side of this. Every month, we publish a live dashboard that is publicly available on our website that gives us population-level insights to what's going on in Arizona. So we track, Medicaid enrollment, we track child welfare involvement, we track justice system involvement, and just overall population movement to help inform strategies and let us know kind of where the market is moving. Just like we're doing today, we also host monthly Power Hour trainings or webinars, and we'll talk more about next month's presentation, but I am super excited that next month we will be featuring Barbara Lang, who is the Health Department Director down in Cochise County, and she is going to be talking about all of the terrific stuff that they're doing in Frontier, Arizona, and they've got some really, really innovative, novel approaches. So please stay tuned or register and join us next month as well. And then through that nonprofit arm that we discussed, we host a monthly networking event that we would love to invite folks to. The networking event does move monthly. So this coming month, which will be August, next month, excuse me, we'll be in Phoenix. And then in September, we'll be down in Tucson. And then in October, we'll be up in Flagstaff. So check out our website, and then we essentially just rotate through that. Every month, we also do a volunteering event. Those are traditionally in Phoenix. And obviously, we are, partnering with community-based organizations and helping them meet the social determinants of health needs and some of the other human needs that folks we serve have. And so please join us anytime. Again, check our website. We do it once a month. We would be honored to have you participate. And then our last announcement for today is around our scholarship program. So we do have a small micro scholarship program that we offer, and applications are currently open right now. Our scholarship focuses on certifying frontline workers to really build workforce. So if you or someone you know is interested in becoming a certified peer support specialist, a certified community health worker, or a certified nursing assistant, or if you operate an approved program for one of those things, please feel free to share the link for our scholarship. We would be honored to support you or someone who's participating in your program so we can build that frontline workforce. All right, all done with announcements. Apologize. And I want to talk about today. So I am super, super excited to have both Sierra Lamb, who is the Climate and Health Manager for the Maricopa County Department of Public Health. For anyone who might be out of state, this is the county seat of the Phoenix metro area. And then we also have Betsy Kamara, who is the Heat Relief and Response Manager for Pima County Department of Public Health, which is the county seat for Tucson, Arizona. So these are our two largest urban centers in our state. And obviously, this is so timely and relevant. Heat has been such a prominent topic over the last couple of weeks. We all saw, even over the 4th of July, heat played a really unfortunate role in some of the celebrations that were happening. And so this is becoming a part of our normal and something that we'll need to be addressing moving forward. So might as well learn from the best and those that are already spearheading great work. I'm going to kick this over to Sierra in just one second. And as folks are talking, I just want to call out, please feel free to document questions or submit questions in the chat box. We're going to do a Q&A at the end. So I'm going to ask that they not stop and interrupt their presentations for those. But if you'll put them in the chat box in the moment, that will help us, get them all squared away towards the end. And with that, Sierra, I'm going to kick it over to you.
Thank you, Robert. Hi, my name is Sierra Lamb. As mentioned, I'm the Climate and Health Manager for Maricopa County Department of Public Health. And so I'm just going to be talking about a little bit of our heat relief efforts, who Maricopa is, what our response looks like, and what the heat relief network is and looks like in Maricopa County. So we can go to the next slide. Just a little introduction to Maricopa County. Our vision is to create a healthy, thriving Maricopa County for all. And our mission is really to increase the quality of life for residents. And this happens by collaborating with the community, which is seen a lot in the Heat Relief Network, implementing strategies, programs, and services, just addressing the emergent needs and changes of public health. Next slide, please. Our team, I always like to say we're a small but mighty team, and it's a little bit smaller than this. Actually, we no longer have our climate and health fellow as of a couple weeks ago, so I should have updated this. But together, this is the whole team that supports everything climate and health related and everything with the Heat Relief Network. It started in the fall of 2023, so we are a newer team, and this is our second full summer together as a team. And together, we also support the operations, both internal and external, an incident command framework to help support the way that we respond to heat, collaborate with our network partners and centers and also city partners. And then we provide water distribution to the Heat Relief Network, supplies, and oversee contracts and vendors. Next slide. Getting into what the Heat Relief Network is. So the Heat Relief Network, it's made up of now 4 different partner types. It was originally just the 3 of the hydration stations, cooling centers, respite centers. So the Heat Relief Network is a network that came together of nonprofit organizations, churches, anyone really who's willing to open their door and help. And they've been around for about 20 years. So breaking down the type of site types is hydration station. This is the easiest entry to becoming part of the Heat Relief Network. It's either an indoor or an outdoor site that water is distributed to the public. So come in, get a water either from an ice chest or maybe a fridge inside, and then go on their way. Cooling centers are a little more advanced. They're indoor air-conditioned sites with water and seating and access to a bathroom. This is somewhere that you're letting someone come in for up to 2 hours or minimum of 2 hours to come in and cool off and get out of the heat. And then a respite center is the most advanced. That's going to be an indoor air conditioning site with water and bathrooms, but a space to rest. So you're able to have uninterrupted rest for up to 4 hours. Could be longer depending on the site, but we ask for 4 hours as the minimum commitment. And this really helps people get down, have their body temperatures fully cooled down, have a place to sleep, rest, even if it's just like a spot on the floor where they're able to lay down. And recently we added heat relief outreach partners. These are people that are out in the community providing heat relief services and outreach services. So they're conducting field-based outreach to distribute water, provide heat safety education, connect individuals to nearby heat relief services. We wanted them to be a representation of part of the network. So they were added in last summer. Next slide, please. This is just a little overview of the network. So it started because in 2005 we had a record-breaking high and 45 deaths. So again, this community came together. They wanted to do something to address the rising temperatures and the amount of deaths. And so the Heat Relief Network was born. So this is actually the 20th year of the Heat Relief Network. And then it was in 2006 that county surveillance on heat mortality began, and the processes that we made to track heat-related deaths versus heat caused or heat contributed has stayed the same throughout that entire time. So 20 years of the same tracking process as well, and it's been adopted by other counties and parts of the country. It wasn't until 2021 that the cooling center standards were actually established. So establishing that you could be in there for 2 hours, what makes a difference of being part of the network, and what resources you're providing. And 95 cooling centers adopted that standards that summer. And then respite center standards were not established until 2023. And it wasn't until 2024 that we had a centralized coordination across the county and the state. Positions were created at the state level and at the county level to help coordinate communication and have consistent messaging and find out things that we can help make a difference and coordinate these efforts across the county and the state. Next slide, please. These are last year's numbers, but what you'll see on the right is a snapshot of the map. So when a site registers on the MAG website, they get added to the map, and you can see where any sites are located, or if it's just whatever ones are active at that time. But this is just a full snapshot of all the sites that we had last year. We had 122 hydration stations, 97 cooling centers, 26 respite centers, all made up of 108 unique organizations. This year, we are seeing quite a bit more. We're at 155 hydration stations and 128 total participating organizations. So this is growing every year, which is really exciting for us to see. Our visits have increased throughout the season. We collect a daily survey for partnered sites. We have 5 cities that receive funds from us. So they submit data to us, and anyone in the network is encouraged to submit this. So this is just to track how many people are using the sites throughout the season. Is it increasing relevant to the maximum temperature? But as you can see from the sites, I believe this came from 28 sites that reported where there was an average of about 100 people per day starting in August and 120 in September. So that just increased throughout the year. Slide, please. Looking at heat-related deaths. So over time, so 2023 was our highest amount of deaths that we had ever seen on record. We had 645. That was not a summer that we had that coordinated response. That was when everything began in the fall of 2023. So once we got that coordinated response and started implementing some of the efforts, and I'll go over those in a little bit, we did see our first decline of deaths in over a decade. We went from 645 to 608 deaths. 2024 was also one of those hottest years on season. We had over 100 days at 110 consecutive days. The temperatures weren't dropping under 90 degrees at night, which is really critical for the body to cool down. So we were really excited to see that dip in number, even though it was small, but with the way that the numbers had been going, we would have expected that to be even higher than 2023. 2025, we also saw another decrease down to 430 deaths. So we were very excited to see that. And again, we think it goes to a lot of factors. It's hard to point out just one. City of Phoenix did a really great job of implementing an ice immersion that was proving to save lives, but we think also the coordinated response, consistent communication has all played a part as well. Next slide, please. 2025 had less days over 110 than the previous years, but it was still ranked the 4th hottest summer on record. So we just like to bring a point to that, because while it was not as hot as the 2 years that we saw those increase of numbers or those really high numbers in the 600s, it's still one of the 4th hottest. So seeing that decrease is, again, very exciting for us. Next slide, please. In 2025, 42% of the heat-related deaths occurred on days with an excessive heat warning. So what that means is temperatures were excessively high compared to traditional like weather patterns and stuff. In 2023, you could see we had 72% of those deaths occurred on days with excessive heat warnings. So again, seeing those numbers drop throughout the years after is something that we're looking for and we're happy to see. Next slide, please. One of the things that many people may think is that the heat-related deaths kind of occur on people who are visiting, who might not be used to the heat. Maybe you think that you've been acclimated, but actually 84% of the deaths were residents of Maricopa County. 9 were just in-state residents, 3 were out-of-state, and 4% residency unknown. So this is just kind of to showcase that it really can happen to anyone. And the next slide as well also shows that because 61% of our deaths were residents who had been in Arizona 20 years or longer. So it really doesn't make a difference if you've grown up here your whole life, acclimating to the heat. This really can happen to anyone. Anyone is susceptible to heat-related illness and death. So looking at the Maricopa County heat response, so the strategies that we followed for the last few years, including this year and the 2 years before, they all came from these guiding strategies. We wanted to, we had done cooling center evaluations and other evaluations to kind of see what gaps were missing, what we needed, what the community wanted, what was preventing people from using the sites. So transportation was definitely a major one. We needed support getting people to the sites. And so we partnered with 211 Solari and provided free lift rides to people who call to their nearest cooling center. So we really wanted to focus on supporting transportation. We wanted to increase visibility of signage for the heat relief networks because what we were seeing is people were unfortunately dying outside of sites. And they didn't know that there was somewhere that they could go because there was no signage. So we wanted not only signage, but consistent signage so people could recognize it all throughout the county. We wanted to expand the hours because most of the hours were closing during the, they weren't open on the weekends and they closed during the week around 4 or 5, depending on the business hours. So we wanted to expand that by supporting with funds to help support staff to be there later in the evenings and open on weekends and holidays. And so that's also comes with our partnership with our local municipalities to expand and support those efforts. And we also partner with substance use to leverage resources and partnerships as well. Next slide, please. Looking back at, again, this was 2025. We don't have much 2026 data, but we did have 247 site visits. We sent our public health liaisons to check in on every single registered site to make sure that they have signage, they have correct hours, and if they need any support from us, we're there and able to provide it. We provided a lot of educational materials such as 2-in-1 cards and heat and substance use brochures out there. We provided almost 8,000 rides that summer to individuals to the cooling sites. We provided 880,000 plus bottles of water distributed across the sites, and we had our volunteers help out as well. Next slide, please. So what this year is, we're still following those same guiding strategies. We fund 24 sites with our ARPA funding that is ending this year, but we're working to secure funding for next year to help keeping that going. We really work with our partners. We work really closely with Phoenix, MAG, and all of our cities to support the network. MAG oversees the map of operations, as I mentioned. Phoenix was the first overnight site. Chandler has one as well, but Phoenix shares a lot of biweekly status updates with us, such as EMS calls and a lot of the data that they collect. And then move to the next slide, please. And this is just our last one. So I didn't cover the numbers on here, but if you go on to our Maricopa County .gov/heat, we have our data, our dashboard, our toolkit. But one of the correlations is substance use and heat-related deaths. We see a very high correlation. About 50% of those who die of heat-related deaths were on a type of substance. So we've been able to partner with our team. We had an naloxone distribution program start last year, and we've expanded it. So every region within our county has a site that's distributing naloxone to those that come in, so they're able to get it and help we've seen from surveys that they have witnessed overdoses and it's helping overturn the overdoses. And so it's been a successful partnership to get that out there. We also are able to use opioid settlement funds to purchase electrolytes to give to our partners, our substance use partners, and our sites, because electrolytes, again, are going to really help with that rapid hydration, and that substances cause dehydration as well. And we have a good internal coordination between the two of us to kind of bridge these gaps and find new ways that we can help lower these numbers that we're seeing with the connection. This was my last slide, so we can go ahead and switch it over to Betsy.
Thank you so much, Sarah. Really, really appreciate that. And I see a couple of questions that come into the chat box. Keep dropping them in there. We will address them as soon as Betsy is through with her portion. And with that, I'm going to kick it over to Betsy to talk about the good work happening down in Pima County.
Yeah, thank you so much for having me. I'm really excited to be here and talk with everyone. Also, yeah, the Maricopa and Pima County health departments work pretty closely together, so it's nice to see a lot of crossover with what we do. So I'll try not to repeat too much, but yeah, I'll let you know what we do down in Pima County. So if you can go to the next slide. So I did want to kind of talk about it. Sarah was talking about how 2024 was the hottest season, and we've seen a similar trend in Pima County as well. So we know that heat events are becoming more frequent. We're seeing more extreme heat events throughout the season, earlier and also later in the season. So we're just seeing that our heat season is extending. And for us in 2025 was tied with 2017 as the warmest year on record. So again, we're just every single year just getting hotter and more dangerous for everyone out there. So Tucson saw 46 days over 100 degrees, 39 days over 105, and then 7 of those that were over 110 degrees, which we do know that it's a lot cooler compared to, not a lot, but it is a little bit cooler than Maricopa, but it's still pretty hot for us being so close to the mountains and everything. So in 2025, we experienced our earliest day on record for 100 degrees, which was a month earlier than the year prior. And then this year, we set that record again in March. So again, every single year is getting earlier and earlier as more hot earlier in the season. You can go to the next slide, please. And then looking at historic trends as well. So thank you. The 2025 heat season review. So in 2025, we saw 893 heat-related illness visits, and this is up 13%. So Maricopa has been pretty amazing in that they're seeing a decrease. Pima County has been pretty consistent, if not increasing, in what we're seeing down here. So we know that the majority of our heat-related illnesses occur among males between the ages of 20 and 44, and then are white, non-Hispanic, and or Hispanic. And most of our individuals are housed, but we do see a significant proportion of unhoused individuals experiencing heat-related illness, which is disproportionate to the population size, where we expect only about less than 1% of our population is unhoused in Pima County. So you can see that this is disproportionately affecting that population and really, really concerning. Next slide, please. I wanted to show this. This is the surveillance work that we do all throughout the summer, and you can see that there are spikes happening during periods of extreme heat, either during a watch, advisory, or a warning. So you can see in the background, there's shaded areas and spikes happening during those periods of time. So this helps us it helps us predict when we can see a higher burden happening within the emergency department system, but also helps us understand that as we start seeing more extreme heat events, we expect to see more heat-related illnesses. So if we're seeing this over time and it's getting more frequent, lasting longer in the season, we expect these trends to continue to increase until we can do something about it, which is reducing the heat in general. And so that's kind of one of our initiatives. And within Pima County is looking at long-term sustainability. So how can we keep people safe in their homes, but how could we actually cool the city itself? So looking at the urban heat island effect, looking at long-term natural cooling solutions to these problems so that we can reduce, even though it's getting hotter and hotter every year, how can we reduce the impact of heat on our individuals? Next slide, please. Some other notable patterns. So we do see that the leading contributing factors of heat-related deaths are substance use and chronic disease. So we are seeing more heat-contributed deaths, which means that heat was a contributing factor to death, but may not have been the primary cause. Whereas heat-caused deaths makes up about just under a third of our deaths within the county. Another contributing or notable pattern is that 20% of our indoor deaths occurred among mobile home populations or manufactured homes. And so you can see that it's only 8% of the housing type. So again, this population is more at risk for death, indoor deaths, because of this, because of the housing stock that they live in, or the housing type that they live in. And then 90% of our indoor deaths involve non-functioning or turned off AC systems. So again, this is highly concerning. People don't feel like they can turn their AC on in extreme heat. And that might be due to a multitude of factors. It might be a broken AC. It might be they can't pay their electricity bill. They're not able to access utility assistance or weatherization assistance. Something else is going on here. And so that's what our team is really focusing on, is how can we keep people safe in their homes? They're not accessing cooling services. So what can we do to help them stay safe in their homes? Next slide, please. And then some other trends that we're seeing. So like I mentioned, our heat-related deaths have stayed pretty consistent over the years. So it's not similar to what Maricopa is seeing. And so we're trying to dive into why that might be. So like we mentioned too, it's getting hotter and hotter every season. So we're not seeing an increase in deaths. It's stayed pretty consistent over time. What we do see a decrease is in our heat-caused death and also our unhoused deaths. So that would be any death that would be like hyperthermia. So heat was the main cause of death. We're seeing a decrease over time, and the proportion over time is decreasing. As well as unhoused deaths. So we think this is directly related to the work that we're doing with cooling centers, with accessibility, with promotion, with letting people know about those resources. We do see an increase in heat-contributed deaths, which would be what we're linking to chronic disease. So we've seen an increase by 23.3%, and those specifically linked to hypertension is 150%. So we do know that there's a link between chronic disease and death, and so that's part of our initiatives that I'll go in a little bit later, but we're working on priorities, we're working on outreach and canvassing related to this. Next slide, please. So kind of thinking about our 2026 season, we have 4 overarching goals of our heat response, which is leading and coordinating a unified countywide heat response, which is very similar to what Maricopa is doing, where we're kind of at the forefront, helping people coordinate, bringing them to the table, getting supplies and getting information into the field, and making sure that we're all working together as opposed to silos, working all on the same goals here. The second goal is strengthening community awareness, so really helping people understand the risk factors, why they might be more susceptible to heat-related illness or death. We're looking at education, outreach, canvassing, all of the above. Our third goal is reducing heat-related illness and emergency system strain. We would like to keep people out of the ER if we can, or the EMS system. We'd like to keep them safe in their homes. So how can we keep them safe? If we can do mitigation, prevention, any other thing to keep them out of it so we're not overburdening the system. But we also want people to understand that they should call 911 under a crisis and to understand those. So it's kind of a dichotomy between the two, but we are trying to help our emergency system and reduce that strain. And then the last one, which I kind of mentioned earlier, is looking at long-term climate solutions. So how can we look at natural cooling? How can we build infrastructure to reduce the urban heat island effect? How can we help people stay safe long-term in their homes as opposed to like a Band-Aid solution? So we're really trying to look at long-term solutions. Next slide, please. So far in this 2026 season, we've had 48 cooling centers, and we only had 33 last year. So we're really increased our reach within the community to help people stay safe. The majority of our cooling centers are actually library cool spaces. So we're really fortunate to have a really well-connected library system that wants to open their doors for cooling services, and they pass out heat relief supplies for us. And they're one of our biggest visitor counts as well over the summer. We also are working to expand accessibility. We are working on transportation to and from cooling centers, like similar to what Maricopa has done with the 211 Solari contract. And I see there's a question in the chat about that, so we'll get to that at the end. But we're looking at respite services. We're looking for resource navigation. We know that individuals who are experiencing heat vulnerability, it's not just heat. They might be experiencing housing instability. It might be weatherization troubles. It might be utility assistance. There's a multitude of factors that are going on. They might have a chronic disease at the same time. There's a multitude of factors that are going on there. And so we're trying to use leverage our network and our strength, which is community health workers and resource navigators, or people that can really help connect to, again, have people feel safe in the community that live in and their home that they live in. And then preparedness and mitigation. We're trying to help people really prepare for the heat. We know it's coming. We know that Arizona is hot, but what can we do to prepare for that? We can set up power outage plans. We can make sure that we have a backup for the medication that we need to keep cool. There's many different things that we can do to be prepared for the heat and what happens in our summers. So helping residents and individuals understand that and give them the tools they need to be prepared. And then we're also working on developing a heat hotline and wellness check program. So again, we know a lot of individuals are dying alone in their homes. And so if we can set up a hotline to connect individuals to resources or connect them to a cooling center if there is a power outage or during extreme heat, again, there's a way for us to check in and kind of reduce those heat-related deaths that we're seeing inside their homes or indoor deaths. Yeah, next slide, please. Another thing that we're working on, again, is kind of the sustainability. We've created a cooling center toolkit with best practices for operations. So we were working on this alongside our really great partners at the University of Arizona, kind of helping standardize how we provide cooling services over the summer. We have a lot of different tips, a lot of different ways they can be prepared for power outages or backup plans. We want to make sure that all of our centers are safe, but also accessible. So we've been working a lot on accessibility, as well as like making sure that we're doing proper cleaning protocols and keeping people safe and hygienic. So those are a lot of the different things that we've tried to do with our cooling center toolkit and promoting that with our partners. Next slide. And another thing that we've been working on is extreme heat vulnerability mapping. So we have an amazing epidemiologist on our team who's been able to take some of our long-term data, our longitudinal data about heat-related illness, death, and EMS calls or emergency medical system calls, and map them within Pima County, and we're able to identify quote unquote hotspots within the city where we're seeing this increased heat vulnerability. So I'm not going to explain this too far, and we can go into this if someone has questions, but basically the purple areas, we're seeing a lot of death and a lot of illness related to heat, and it aligns pretty closely with a social vulnerability index. And so we're seeing that heat is really linked to social vulnerability. And so what can we do in these areas? And we've identified and targeted these areas and partnered with the Red Cross and the Medical Reserve Corps to do door-to-door outreach and canvassing to help people understand their vulnerability, get them connected to resources, and make sure that they can feel safe in their home. And if there is a crisis or an outage, that they know where their nearest cooling center is. So we're really hoping to see that this reduces people's vulnerability and makes them more aware of the resources available for them, and so that they can get connected and get safe if needed. So yeah, we're really proud of the work that we're doing, and we're constantly looking at new ways to add new layers and new factors to understand heat vulnerability better so that we can navigate and use our resources better. Next slide. Like I mentioned, we're seeing a lot of deaths and illnesses related to like medication use or chronic disease. And so we do a lot around education about medications and heat safety. And so helping people understand that when you're on a medication, your body acts differently to the heat, but also that your medication acts differently to the heat. So there's kind of two things that happen. And so having people understand how they can keep themselves safe. And so we use this as a guide. It is not a medical recommendation or anything, but people can use this and take it to their doctor and say, hey, talk to me about this. I'm on an SSRI. I am on a blood pressure medication. I am on something that is affecting the way that my body is reacting to the heat. Like, talk to me about this and how I can keep myself safe. So again, we're trying to empower individuals and help prepare for the heat over the summer. Next slide. And this is our summer preparedness, summer safety worksheet that I kind of mentioned earlier about preparing and mitigating for heat. We know that extreme heat, monsoons, and power outages happen every summer. It's inevitable. So what can you do to prepare for that? So we kind of created this checklist alongside our partners at the Red Cross and Medical Reserve Corps. And so created this checklist that people can look at and prepare and come up with a plan for anything that happens. Next, and I believe that's my last slide.
Thank you so much, both to Sierra and Betsy. This is so much information, and I know we have a ton of questions coming in through the chat box, and then I know that there's a couple of other things I wanted to kind of deep dive as well. So we're going to keep the conversation going, and if you have something that you would like to ask either Sierra or Betsy, or Will's on the line, we can harass Will a little bit too. Happy to go through those. So I am going to first go through the questions in the chat box. I'm going to skip the first one real fast because I know the 2-on-1 conversation is probably going to have lots of layers to it. So I want to first start off with a question around any city contributions. So do any of the local utility companies contribute to fund heat mitigation activities, or have there been any partnerships with industry along those lines? And yeah, whoever wants to go first.
I guess I'll go first, but I think we'll probably have a similar answer. But yes, they do. We do have a partnership with SRP and ABS. They will help. They've helped fund Solari in the past. They help with their own, sometimes like AC repair or just other things. But yes, they have contributed in the past with some funds.
Yeah, with us, we are in communication with our electric or utility companies quite closely, but we haven't received any funding yet. But we are hoping that, again, with this kind of 2-on-1 conversation, that we can leverage kind of these partnerships and kind of express the need to contribute to kind of the heat efforts and the heat response. Yeah.
Yeah, absolutely. I'm going to go through a couple other elements that we kind of staged some questions in advance, and then again we will get to 2-on-1. But y'all had talked a little bit about your partnership with the Red Cross, and do you mind kind of expanding on what that looks like and what that partnership has looked like, and maybe even give us a little bit of an origin story on how that came to be and what it looks like today?
Yeah, I can jump in first. So, yeah, we have a very close partnership with our Red Cross, and we're very proud of the relationship that we've built. Our chapter, the Southern Arizona chapter, actually just won an award for the work that they're doing with the heat, as seen as like a nationwide response. And so it's interesting because heat is not technically considered a disaster. So they don't actually get funding for the work that they do through like the federal government or anything until it becomes a disaster. And so this is all work that they've done on their own because they've seen the need and the impact in the community. So our local chapter has been amazing in kind of being the forefront of canvassing and outreach. They've organized all of their volunteers to do this door-to-door campaign, and they've really wanted to partner closely with us to identify these areas. So our vulnerability map, which I showed a few slides earlier, has directly impacted the work that we're doing to help us target those areas, to look at hotspots, to understand where our resources can be most identified. So yeah, if anyone's familiar with the Tucson area, the Flowing Wells area, as well as on the south side, you can see a lot of purple. So it's the northwest part of Tucson and the south side. We did a lot of canvassing in that area, and we're hoping to see that impact and kind of see the data-driven approach to see before and after what did our efforts do. And so they've been amazing and really helped us. We could not do the canvassing without them. And we don't provide funding for the work that they do. They just do it because it's part of their kind of their mission and their goals to see a difference in the community. So we're really proud of that partnership.
That's awesome. Sierra, did you have anything you wanted to add from Maricopa County's perspective?
I think Betsy just about covered it. Pima County started that partnership first for the door knocking, and we ended up mimicking that. We did one door knocking event last year prior to the summer, and then this year we did more and tried to organize more, and kind of based off the same thing. We looked at our maps where we were seeing trends of heat-related deaths, especially those in mobile homes and stuff. So we wanted to target those areas, and we were able to get a couple events done this summer too, or prior to this summer as well. So they paved the way, and we definitely followed, and it's a great partnership. It's amazing.
That's awesome. That's awesome. When we were doing our planning conversation, y'all had mentioned some really interesting and it's a little macabre, so forgive me, but some emergency response strategies that were emerging, specifically around some ice bags that we might be using. Do either of you care to kind of share a little bit about what that intervention looks like and how it may be helping?
Yeah, I can take this one. So this was a City of Phoenix led initiative. Their EMS team were able to patent it. So basically, essentially, it's kind of a body bag that when they go on scene and someone's having heat stroke and their temperature is over a certain amount, they are putting them in this and fully immersing them in ice and water and then transporting them. And what they are seeing is that people whose body temperatures were maybe a temperature that most people would not come back from were surviving. So it was really helping. It was rapidly cooling the body. They were still able to administer other life-saving resources that maybe be needed. They still have like access and are able to work on the patient if needed on during transport. But this was something new that got patented and evolved, and I believe last summer was the first summer that they fully implemented it. 2024 was kind of like the idea. I think they had trial run it. I remember them introducing the idea in 2025. They implemented it. So we also think that's a huge reason why we did see such a massive decrease of was those efforts to help save lives because it was working. They were seeing people surviving. So it's really awesome.
Yeah, I think it's obviously such a novel intervention. And I believe, if I remember correctly, it was actually they demonstrated it on the pit. If anyone watches that show, there was an episode where there was a heat-related response, and they pulled out a bag and pumped it full of ice and water and stuff to help bring that body temperature down. So it was cool to watch.
Mm-hmm.
Yeah.
Awesome.
And then I also wanted to quickly ask about, I know that this, a lot of the strategies and the work that we're implementing today, some of it may have come from, other communities. And then conversely, or concurrently, I should say, we've also had, lots of other communities, excuse me, reach out to you guys to get lessons learned. So you kind of talk a little bit about what that multi-region, multi-state, kind of national level collaboration looks like. And I understand that is the case both for Maricopa and Pima counties. So please, if you don't mind, both sharing about what some of that collaboration looks like.
I can start since I'm still off mute. So yeah, we've definitely had a lot of communities reach out to us, a lot in California, even in Oregon, Washington, Nevada. So some of them have just been like quick check-ins and kind of explaining the process of like the heat relief network, how we've gotten on board, how we've gotten signage, how do we get people to sign up, where do we get the funds from? So kind of the back end of it to some of the partnerships go a little deeper that I sit on a month or a quarterly call with Contra Costa County in California and just kind of listen into their heat stuff and if something comes up, but we just want to keep that partnership alive. So definitely a lot of like conversations on lessons learned, best practices. And we always tell them, we're still learning too. We're also kind of new to this, but we do provide that information. But it's even gone globally that we have government representatives from Tokyo actually in town this weekend. They're talking to Tempe. They're reaching out to us. We'll be having a meeting with them in just a couple hours, actually. So they also want to learn lessons learned. So that's really exciting. It's really cool. A lot of people are looking at Arizona and what we're doing and want to learn. So it's really awesome to get those opportunities to talk and hear what they're doing, what the challenges they have as well. But definitely just like a lot of check-ins and meetings and kind of what's going on, what's new. But I'll let Betsy also answer this.
Yeah, very similar. We've had some outreach from like Texas even and New Mexico, and I think we're all just trying to learn and grow together, and it's really cool. I will say that even the local response within the counties has been it's way more coordinated than a lot of other emergency response. It's usually pretty siloed. There's one person taking point, and so the fact that we've built such a strong coordinated program just among ourselves and can use that to it could be used as an example for lots of other responses, I think is really amazing. And it's something that we can kind of hang our hats on and toot our horns for and say this is an amazing initiative, and people look to us as an example and say this is amazing, look at all the partners they've brought together, look at that coordinated effort, look at the non-siloing, which you see a lot in public health, unfortunately, because of that. And I think maybe it's because we are grant funded and looping together random resources. And so we have to get really creative and be really dedicated to the response, right? And so we all are passionate about this work, and you can bring together a lot of partners. So yeah, it's really cool, and I hope other programs can kind of take this and run with it as well and learn from our mistakes, but also our best practices. You know, there's always something to learn.
Absolutely. I know I've been reading a lot of news articles and reports, not just from Arizona locally, but nationally and even internationally, just around how extreme heat is the new norm. That we are living the effects of climate change and environmental change, and that this is something that not only affects us in Arizona, but affects everyone, right? And I don't know if that's the link as to why folks are willing to coalesce around it, but we all walk outside and experience what that's like. So I think that shared experience could definitely participate or help create motivation. So I do want to go to Will's question around 211. And so just to briefly contextualize this again for folks that may not be super familiar, there's an organization in town called Solari, and they run a statewide call center. That call center has lots of different lines and purposes. It includes the psychiatric crisis line and a couple of other things. And as the team shared, they also served as the community information and referral line, which is what 211 is. It's a free 3-digit number you can call and get information through that call center. And recently, the state budget did not include continuation funding for that service. And so while 211 Community Information and Referral will continue to exist as a website and a digital resource for the community, find a food box, find housing assistance, utility assistance, childcare assistance, transportation, really focusing on those health-related social needs. It does sound like we will be losing the capacity for that heat relief call center where folks would be able to dial in and find their local nearest heat relief site. So Sierra, I'm going to ask if you don't mind kind of sharing a little bit more about this and seeing Will's specific question is how critical, is 211 in messaging and coordination. And if I may add my own 2 cents on top of Will's question, if you don't mind talking about those lift rides and transportation to heat relief sites, because I think that's obviously a really important resource for many families and individuals.
Yeah, definitely. It's very critical. This has been something that we've seen as a life-saving resource. It's definitely been one of our top priorities of trying to provide the rides to support 211 in the call center and have this resource available to our community. It's something that we advertise for on billboards. We put a lot of attention and really want to spread the word because these rides are life-saving. Like I said, we saw almost 8,000 rides. I forget how many unique individual riders, but it would have been somewhere close, definitely in the thousands. And so what it looks like when you call 211, it's not just for lift rides. They do have resources. If you need an AC repair, they're able to connect you, or if you just have general questions about heat or there's other resources that they do provide for heat relief, not just rides, but the rides are a big component, and they're able to pull up the map. They're well trained on the map at the mag map. They have a list of questions. They're going to get you to the closest center based off of your needs. So if you have a pet and your closest center within a mile or 5 miles doesn't take pets, they will take you to the one that's maybe 7 miles away if needed. But their mission is to get you to the closest center nearby. If you just need a cooling center, or maybe you might need case services as well. But Solari is really awesome because they are able to track if it's repeat callers, repeat riders, are they new? They've been able to track down patterns with someone who is maybe using the service a lot of times and find out, and they just ended up having a conversation with them like, hey, what's going on? Like, why are you going to this cooling center? They were able to find out why, help connect them to a resource, and then that person no longer needed the rides or to be going to the cooling center because they were able to get the resources needed in that moment. So not only are they providing rides, but they're actually care about those who are calling and they want to help, and they go the extra mile to connect them to further resources when they see there's repeat callers. So it's really been amazing. Definitely a great partnership that we've had over these years. And we do have funds, we have the budget secured for rides throughout the end of the summer. So it's our mission. We're going to get these rides. I know it's going to be upper leadership is working really hard. I know our deputy director is working very hard on this to secure something. So I just know that they're saying we'll figure something out, and I believe them, we will. But as of right now, it is unknown. It does look like Solari will be closing the doors in August, I believe, mid-August. I forget the exact date, but we're working really hard to find a way to still get these services throughout the summer because we do have the budget for it, and it's an important resource.
Yeah. Thank you for sharing that. Betsy, did you have anything to add?
Yeah, I will say that we're just a little behind the mark in terms of getting 211 and transportation. We had some trouble like securing funding and kind of getting that. They do still support Pima County. They still provide resource navigation, and they will provide rides. They just have been doing it independently from our funding. And so we finally secured funding this year, and then we found out about the decision. And so it's kind of heartbreaking that we thought we could kind of bridge that gap. It's our number one requested resource is transportation to and from cooling centers. And when we go back and interview some of these people that could have accessed cooling and they didn't, it's because of transportation. So we know that this is a major barrier for people being safe over the summer. And so we were hopeful that we could get this secured. And now with this decision, it's heartbreaking. So yeah, it's going to affect it's going to affect the whole state for that matter. And it's going to affect everyone. And not having this kind of life-saving resource in place is going to be devastating. And we're going to see that. We're going to see the numbers rise this summer. I guarantee it. Yeah.
Well, Betsy, I'm gonna ask you one more question, and then I'm gonna move us over to our call to action, which I'm gonna ask both of you all to help me kind of chime in and bring home. But along those lines, when we were in our planning conversation, Betsy, you talked about New York's Be a Buddy program, and I think that this, really resonates for those individuals that are living in those manufactured homes and maybe older adults and social isolation and folks that may not have someone there to check in on them. So do you mind just kind of talking about that intervention a little bit and what that looks like and its impact?
Yeah, absolutely. Yeah. So we, like I mentioned earlier, we were trying to implement a heat hotline and a wellness check program. And so we worked with a lot of we tried to look at very successful programs all throughout the country to see how could we build off of their success. Again, looking at best practices to inform the way that we would like to program. And so we found the New York Be a Buddy program. We met with them a couple times. Actually, the city of Phoenix met with us. We're all trying to do this kind of program together. And they shared with us that they've gotten such great community support and feedback from this program. And so we were able to kind of mimic that. And so that's what we plan to do this season as well, and to hopefully continue it onwards. And so, yeah, it's a really cool program where they've been able to build off of pre-existing programs. So again, not recreating the wheel, but looking at who's already doing these. And it might be through like church calling programs. It might be through other senior programs, might be a Medicaid calling system, whatever it might be that's already pre-existing. And then they're leveraging those, adding volunteers, adding resources, really supporting and promoting what's currently happening so that they can kind of call people and get people safe.
Yeah.
And a lot of people, their response has been so positive. They're like, thank you for the call. Thanks for checking in. Thank you for getting me connected. I didn't know I had a cooling center up the street, whatever it may be. They're able to just understand and feel like they're important, feel like that they have someone checking on them and kind of do that. So we are still we're working on it, but hopefully in the next couple of weeks we have it up and running and we really see a positive impact as well. And now that 211 is kind of going away, we hope this fills some sort of gap. We're not going to be as good as them. We never will be. I mean, 211 is amazing, but we're hoping that this will fill a gap in Pima County and help people get connected as needed. Yep.
Well, thank you guys. And of course, if there's any last minute questions, feel free to pop them in the chat box for us. But definitely wanted to take a second to really focus on what can we do? What are some of the things that for those that are participating today that may have to step outside at some point and experience Arizona's extreme heat or the extreme heat where you may be residing? And so Sierra and Betsy helped identify kind of these very actionable recommendations. Of course, increasing awareness, sharing, talking about this event, talking about your lessons learned, sharing information about different strategies we've talked about here, getting familiar with the different heat relief resource maps and all of those things. Obviously, educating yourself and your team, your staffs, the folks that you work with on the symptoms of heat-related illness and those vulnerabilities, those populations that might be most at risk, or when you see that combination of substance use or experiencing homelessness or being unhoused, recognizing, where those risks might reside. As we described, that checking on your neighbors, be a buddy. I think that this is a really important opportunity for us, as the data suggested. This is one of the highest proportions of folks, that we are experiencing the harmful effects of this heat. And so if you've got members, if you have patients, if you have clients, that are living in those stock types of manufactured homes, trailer parks, or living alone, especially older adults or folks with hypertension and these medical complexities, chronic diseases, folks have identified today, figuring out how we can do that extra check-in. Hey, maybe we need to add that, how's your AC running, right, to our community health worker outreach, just to make sure that we can catch that in advance. Both Maricopa and Pima County did clarify that they themselves do not accept donations. However, they do ask that folks would submit donations or offer donations to their heat relief partners. And so if you, as an organization, are interested in raising money or actually purchasing a pallet of water, please feel free to directly donate to their partners. We ourselves, at Health Impact Community, our charitable arm, we gave a donation to St. Mary's Food Bank, which purchased a couple pallets of water to support heat relief, and we were just honored to do that. It's a very easy way to have an impact. I am going to put both of these links in the chat box for the different toolkits, and they may already be in the chat box, so forgive me if it is redundant. But want to make sure that folks have access to those because they are, oh, well, that didn't copy very well, forgive me, just because they are such well-developed resources for everyone, both here in Arizona and broadly. And so please feel free to share those out. And then, of course, training your staff and making sure that you are aware of your local heat relief site and all of that. Sierra, Betsy, any final thoughts or comments before we wrap up and I move on to a thank you?
I think that calls the call to action really beautifully. I also put links to our toolkit and everything in the chat, but I did want to say we do have a training that anyone can take on knowing heat-related illness and when to call 911. It takes about 10 minutes, so great thing to also take advantage of on there. But no, that's Amy.
Yeah, I will just say I feel like everyone can do something to help someone during heat season, and it might just be passing out a water bottle. It might be having a case in your car that you can pass out as you go. It might be offering a shaded tree for people to sit under. There's always something that we can do to help people, and it affects everyone. It affects every age demographic, every income level. Everyone's going to be affected by the heat, so it's not unique, and everyone can do something about it. So thank you for attending and being passionate about this and continuing to work in this space. We appreciate everyone.
Yeah, there's a big shout out to Francisco and the big clinics in the chat box. So thank you for all of that hard work. Here is both Sierra and Betsy's contact information for how you can reach them. There's also a QR code for an evaluation survey. If you can, please fill that out. This is a grant funded project, so we do need surveys and evaluations. If you can help us get those, very, very much appreciate that. And we'll send a link out for everyone after the fact also. And then just very last minute reminders of announcements. We do have next month, Cochise County will be profiling. Please check out the Hess report, which is online and available, and gives you some great market insights. Join us for happy hour if you want. Join us for volunteering. Consider sharing our scholarship with anyone that you know that may be interested. But thank you for participating today and spending a little bit of time with us learning about Arizona's life-saving work related to heat relief. Let you guys have a great afternoon.
Thanks, everyone.
Thank you.